Hello, my name is Patrick and I'm a PhD student at the UCL Institute of Health Informatics. The next 3 minutes I'm going to talk about the P that you see here on the slide and the bacteria that may or may not be in it. So why am I interested in the bacteria in this urine? Because it plays a central role in diagnosing urinary tract infections. Most of you might be familiar with urinary tract infections. They are among the most common infections after all, and particularly if you are a woman. There's a good chance that you had at least one of them in your life. Given how annoying they can be if you have one, it might come as a bit of a surprise of how difficult they can be to diagnose reliably, and this lack of certainty is a problem. When doctors are unsure whether you do or do not have a urinary tract infection, they often opt to give you antibiotics nevertheless, just to make sure you don't develop more severe and life-threatening infection. Doing this in 1 to 2 patients isn't a big deal. However, if we do this too often and too liberally, it may become a major driver of antibiotic resistance, something we all here at this festival try to avoid. So why is it difficult to diagnose urinary tract infections? In short, the tools that we currently have aren't ideal. Besides asking you about your general symptoms, doctors usually perform a range of tests on your pee, the very one that you see here on the slide. They put a little paper strip into it, which changes colour if certain substances are present or absent in the pee. Alternatively, they may analyse your pee with a machine called the flow cytometer, which uses a laser beam to count particles in your urine. Both methods only provide indirect evidence of infection. The most reliable method that we can have is urine culture, where we leave this pee in a warm place and see if the bacteria that may be in it grows. This process, however, takes up to 2 days, which is way too long for our poor patient. So this, finally, brings me to our project. We're trying to use a technique called machine learning to bring all this information that's collected about the patient together and try and give A&E doctors a better test. My colleagues and I have developed such a computer program together with researchers at the University Hospital Birmingham, and we are quite happy with the results. Before we can use it in practice, however, we need to make sure that it really works. So to this end, we're getting anonymous historic data from urinary tract infection patients at UCL hospitals to see how well our program would have worked here. We'll then use this additional knowledge to further improve our program and hopefully provide doctors with additional information that makes it easier for them to diagnose urinary tract infections using this